Recording, and say and spell your name and give your title, please.
Yeah, my name is Kristian Andersen. That's Kristian Andersen, and I'm a professor at the Scripps Research Institute here in La Jolla, California, in the Department of Immunology and Microbiology.
And today we're talking about how, first of all, what is genome sequencing, right? And more importantly, how is it helping trace and figure out the movement of COVID-19?
Yeah, so what we're doing here together with the county here in San Diego, local academic partners, UCSD, as well as hospitals in the region, is that we're doing what's called genomic epidemiology. And genomic epidemiology is sequencing the virus SARS-CoV-2 from patients that are infected with the virus. And what we're essentially looking for here is that as viruses are spreading in a community, like here in San Diego, the virus is picking up little mutations every now and again, on average, 1 or 2 mutations every 2 weeks or so. And those mutations, they typically don't do anything to the virus, so the virus still remains the same, but they leave little blueprints in the genomes of the virus, which allows us to reconstruct the spread of the virus. And the reason why we can do that is that you can imagine that as the virus is spreading here in San Diego, for example, the kind of viruses here pick up little mutations that we can then identify as being from, okay, these are the types of ones we see in San Diego. As the virus spreads, for example, other places in the country, maybe that's LA, maybe it's New York City, it's a different set of mutations. So if we can use sequencing, we use sequencing here and reading out all these little mutations in the viral genome, that allows us to construct, they're called phylogenetic trees as the technical terms, but think of these as family trees, essentially, of the virus, where we can reconstruct how the viruses are connected. So we can look at, these are children, these are cousins, these are brothers and sisters, and then we can use that type of information to understand the connectedness of the spread.
And does this have this information, aside from learning about how it moves or spreads, does it help with something like making a vaccine more efficient, or any of those kinds of things that are kind of important too?
I would say like the first sequence, which were released by Chinese researchers back in the beginning of January, is what formed the basis of the vaccine. So, you know, that's that first sequence that was made available meant that, okay, now we can start developing the vaccine. So the fact that they did that, you know, really quickly has really helped us in terms of just getting these vaccines under development. What the sequencing we do now, while not directly involved in developing vaccines, what it can tell us is that once we start introducing the vaccine into a population and we start preventing spread via that vaccine, is there, you know, any evidence, for example, of the virus evolving some sort of resistance to the vaccine, or is the evolution of the virus itself responding differently once we have a vaccine, or once we start giving antiviral drugs, monoclonal cocktails of antibodies and things like that. So it becomes a really important tool once you start introducing these types of mitigation efforts.
And so, I mean, I'm thinking, and you know, we have a flu vaccine every year that we take in hopes, based on stuff we knew about the strains from last season, and that's what makes it effective. I'm assuming that we're going to need a COVID vaccine for quite some time. And so does this research help track that sort of thing? Is that, if I'm asking the right question?
Yeah, you know, absolutely. So one of the things we see with the flu vaccine is that flu evolves around the vaccine pretty much every year, right? And that's because flu, you know, it's in birds and it's in pigs and it's in humans too. So, and evolves really rapidly. So the flu is highly capable of evading the vaccine. And that means that every year we have to update the vaccine so it fits the variant of flu that we think is going to hit us in upcoming flu seasons. So that's one of the reasons why we need to take that flu vaccine every year. A big open question we have around COVID is that, is the same going to be necessary? And the answer to that is that we don't know. Until we start introducing the vaccine, until we start actively fighting the virus with the vaccine, we won't know the answer to that question. What is important here is that the sequencing of the virus, it's what's going to tell us the fastest, because we now know, in the absence of a vaccine, we know how the virus is evolving, which is sort of just bouncing around in evolutionary space. We don't really see any directionality on any of this, as we would expect. The question is that once we introduce the vaccine, is it starting to look different from what we, for example, see now? So that type of sequencing is going to be really important for that. What I should say, really importantly, though, is that getting the first vaccine, we had really good news over the last week and a bit, right, around the really early vaccine news. It doesn't mean we have a vaccine now. This has to be clear, right? And even if we do see an approval of a vaccine pretty quickly, it's going to take time before you and I and the rest of the population will have access to this vaccine. Very unlikely to happen, before sometime later next year. Right. But let's assume, and all the data would suggest, that we will have an effective vaccine. We will have a vaccine that we know is going to work. We just need to produce it. We need to, distribute it. We need to make sure that people take it, all of which is difficult, but certainly doable. Once we have all of that in place, should the virus evolve some sort of resistance to the vaccine, whether that's partial or complete, our ability to update the vaccine based on these types of sequencing is much, 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 much easier than actually developing the first vaccine. So I would say that even if we are going to see some evasion of the vaccine, that the virus is starting to evolve resistance, we're going to be very able to deal with that problem just by updating the vaccines, like we see with flu, for example, right? And for flu, it typically takes a few months, and then we have an updated vaccine, and we can do this early, and it's all good. And again, doing this early is something where the sequencing is going to be really, really helpful, because we will start to see, if it does start to develop resistance, the sequencing will actually tell us.
Is there anything I didn't ask that you wanted to say?
I would say, like, some of the really important things that we're interested in here is just understanding transmission of the virus in the local area here. And we can only do this because we work so closely with the county, and we work so closely with the local hospitals, and we work so closely with academic institutions here, as well as with the state of California, and also now the CDC. So, the really important part about that is that we get some insights into when COVID is, prevalent in the community, and when the virus is actually spreading, what are the things driving this type of spread, right? And if we just compare, some of the things we found is that we compare really early on during the spring, and the first sort of spread we saw in this community was, from the virus's perspective, really rather unsuccessful, because these transmission chains that got started never really got very far. So early transmission was really, visible, seeing like a lot of these stuttering transmission chains. And of course, then the lockdowns came in, right? And that sort of really dropped it down. But what we can now see is that, over the summer, and certainly here into fall too, is that it's much more dominated by like super spreading events, and events where the virus locally becomes really, really successful. Bad news for us, but successful for the virus, right? So I think what's really important about that is that it again tells us that things like wearing a face mask, physically distancing, limiting time spent indoors in crowded settings and with a lot of other people, if we can minimize these, we don't need to fully prevent them. If we can minimize these, we can keep the viral transmission low. And it's really important, right? Because there's sometimes this confusion around, people like me just want to lock down societies, and so, but the thing is, like, lockdowns are not ways of fighting this virus, right? We don't want this. Like, lockdowns are only emergency breaks. When transmission gets completely out of control, we can no longer control it, that's where partial lockdowns can come in effective. And that's what we're seeing in the tier system here in California, right? Where right now it's necessary to again, by minimizing time spent indoors, to minimize indoor dining, for example, and bars, right? So our data really tells us that, right? But I think it tells us the really important story of how could we be successful. And we could be successful, again, all wearing the face mask, physically distancing, minimizing time spent indoors in crowded settings. And that will allow us to drive transmission low enough such that we can keep it low enough. And by keeping it low enough, we do that contact tracing. Soon as new infections come up, we break new transmission chains. And what's really, really important with that is that is the way to prevent lockdowns entirely. So all our businesses can continue to stay open, not just, open, but actually stay open. And again, our data really shows us that between what we saw really early on, where a lot of stuttering transmission, the virus is not successful at all, versus what we see now is a lot of just super spreading events driving transmission.
And that's essentially that information is what has led us to where we are now. We've moved into that purple tier. We are on some partial lockdowns, and it is because of that information that we know that, indoor dining is unfortunately bad. We all love it, but it's bad. And
we know
that's where we're at, right?
Yeah, I think, I would say like our data is consistent with what we learned from just normal epidemiological investigations, right? But what we have really learned over the last many months around COVID and SARS-CoV-2, the virus causing COVID, is that, a lot of spread is via these super spreading events. Like up to 80% of all the spread that we're seeing is via these massive events of super spreading. And we know what leads to that, right? And the reason for this is that while we thought early on that probably a lot of spread is dominated via touch, what's called fomites, right? Maybe it sits on the surface, maybe larger droplets between individuals sneezing and coughing. We now know that actually what's called aerosolized spread, where the virus gets into these micro droplets and can sort of hang in the air, which happens from just talking like you and I doing right now, is that we know a lot of the spread is because of that. And that sounds scary, but it's actually really good news, because these are the kinds of things we can prevent or minimize, I should say. We can never prevent anything fully, but the good news is we don't need to. We just need to prevent as much as possible. And that's why things like face masks are so important, especially when talking, right? Because talking really leads to a lot of aerosolization versus like sneezing, while also, leads to a lot of aerosolization, also leads to bigger droplets, which fall to the floor pretty quickly, right? Is that just this, activity of talking, singing, shouting, certainly, right, can lead to a lot of aerosolization of the virus, and a lot of this from people that don't even know yet that they're actually infected with the virus. So that's why we now know that, again, minimizing time spent indoors with a lot of other people, again, not fully prevent, but minimize as much as possible, right? Wearing face mask, effective face mask, physically distance from other people is really the way that we can get this virus under control.
Right? I call it priority of exposure. I don't know if that makes any sense, but in my household, it's priority of exposure. Do you need to go there, and how long? If you need to go to that place that is indoors, how long do you have to stay? Don't stay any longer than you have to. That's what I'm getting, which is the idea is outside is okay. But inside isn't, unfortunately.
No, and I think that because it's really important, right? Because it's not black and white, like you cannot do it all, right? It's a question of adapting the way that we work, the way that we eat at restaurants, right? We go outside. In my family, for example, we get a lot of takeout, right? So we still visit the restaurants, we still, buy food from them, but we don't eat it there, right? We bring it home with us. I'm working from home because I have the luxury of being able to do that. There's many people that can't do that, right? And that's why it's really important that people like me who can, I do.
Right.
Because it's not that each individual needs to like do all these things. It's as a community, as a society, right?
People who
That the
can
people that can
Yes.
should do it, right?
Right.
And
Agreed.
again, we are really, and we see this in our data, right? When we know it from all kinds of other investigations too, is that again, by doing these things, we can actually drive the transmission down. It doesn't mean we're not going to see future flare-ups and things like that. But if we see these at a level where we have really low ongoing community transmission, we can actually go in and effectively stop it. And we have seen this from many Asian countries, right? South Korea, Hong Kong, other places, right? And we've also seen it, you know, even in Europe, certainly in Oceania, with Australia and New Zealand and other places, right? That it can really be done. Here in this country, we have unfortunately chosen a different strategy to this. So I would say a lack of a strategy, where we have not tried hard enough to fight the virus, right? We sort of like, we have this belief that if it plateaus at some point, we're probably fine. But the problem is that that plateau gets higher and higher every time. So once we start seeing these flare-ups, which is what we are experiencing right now in San Diego and certainly across the country, is that we can't go in with our normal like testing, tracing to actually bring it back down, right? Because it's too many transmissions. And that's why things like, unfortunately, lockdown measures, like partial lockdowns measures, become necessary. Because if we just let it go, well, it's only going to go up, right? Our healthcare system will be overrun, people will die unnecessarily, right? So that's the, like, again, our data tells us this really strongly, right? That, look, this is something we need to work on really hard to ensure that we bring down transmission low enough so we can control it and not let the virus be in control, which is currently the case.
Very good. Thank you so